Um, Good afternoon, everybody. At the outset, I would like to thank ARC and Dr. Partha Biswas, Dr. Bhavan Kule for inviting me. And after designing one or two instruments, I did not think I was fit enough to suddenly start talking about how to generate innovative ideas. And it took me quite a lot of time to actually think how to actually research for this. And I would like to thank you, sir, because these are leaders of AIOS. I'm being projected to potential, employers of tomorrow probably. But nevertheless, let's look at what I did when I then made a couple of instruments for retinal surgery. So, invention and difference between invention and innovation is invention is creation of new products, processes, or technologies which did not exist before. Vis-a-vis innovation, which is transformation of ideas into useful applications. So in short, innovation is jugaad. So an inventor may come up with new product or technology or processes that he thinks is important, but it may or may not be important to the end user. Vis-a-vis innovator envisions and makes the valuable applications of the existing technology and products. And in our case, they are useful to the clinician. So how do you become, how can you think of new innovations is by being unreasonable. George Bernard Shaw said that a reasonable man adapts himself to the world, while unreasonable one persists to adapt the world to himself, and therefore progress depends on unreasonable man. So the key is to get frustrated. What is frustration? Frustration is difference between expectation and reality. And when you get frustrated, either you develop a solution to change the way things are, or you just accept them and let go. So if necessity is mother of invention, frustration is father of innovation. So you need to get frustrated. You need to not accept things as they are, challenge them and change in a manner that is suitable to your needs and possibly to the other colleagues. So what are aims of innovation in ophthalmology is preservation, restoration and enhancement of vision of individual patients and society as a whole. So innovation cycle goes through 3 stages. That is, you identify a problem. A clinician is the one who is fit to do this. It's a clinician can identify unmet clinical and non-clinical needs. He develops solution. How do we do that? You can't do it by yourself. You can have an idea in your mind, draw it on a piece of paper, and then you need to collaborate. You need to collaborate with scientists. You need to collaborate with industry people, probably government agencies, depending on the solutions that you have in mind. And then you just don't keep it to yourself. You disseminate the knowledge in society meetings and at public at large. So this is the story of my innovation, one of my innovation cycles. This was a large non-metallic foreign body on the retina, which I could not remove. And then I developed this forceps, which could remove large non-metallic and non-magnetic foreign bodies, which ultimately helped me to remove a really large stone from a patient with trauma. This was a stone foreign body, and it was pretty huge, which we could pick up and take it from the limbal incision. So it helped me when encountered with same problem next time. And as you can see, it was really big. It is one of the, this is the largest foreign body I have ever removed. So it helped me in the similar situation, what I could not do before and what I could do, and how it helped the society at large, because this was the device which was used in Kashmir in 2006 when pellet gun trauma was at its peak. So it was, though I developed it for my needs, it became useful to the society at large as well. And I presented it in last year's AIOC meeting, and AIOS was very kind and gave me this award of best paper in trauma session. So the types of innovations are either disruptive, like IOL, phacoemulsification, anti-VEGFs, or microincision glaucoma surgery, etc. They have changed the way things are done, and they require a huge amount of resources, which all of us at individual level may not have. But most of the innovations are incremental. They happen at your level and mine when we put our mind to solving small problems. And these are the techniques that are that are described, that scramper, that you substitute or simplify, you combine two existing things, adapt it for newer purpose, you change their size, magnify, minify, modify, you can put them to other uses, you eliminate certain part of existing tool or processes, or reverse and re-engineer. So Dr. Richard Lindstrom is American ophthalmologist and who has over 40 American patents to his name, and these are the attributes of innovations worth pursuing that he has put, and I have just taken screenshot of that and put it for you. So it carries a lot of meaning and it carries a lot of weightage when we read this, that the innovation must resolve an unmet, poorly met or partially met need. It should have potential market size that must be large enough. It must have a delivery channel for the innovation. The innovator must protect the idea by doing idea with patents and trade secrets. That is intellectual property. This is where I think we in India fall short, and as AIOS hackathon, just a couple of minutes more. AIOS hackathon is way of moving the innovation forward. I'm sure the next step where AIOS management will be looking at will be to protecting our intellectual property, and that would be the next step that I'm sure they will be thinking of. The innovator must surround himself with advisors and managers. That is where again, so AIOS, the stalwarts of AIOS will help small innovators like us in doing those things. So we need to understand what already exists before we get our innovation out. There needs to be an exit strategy once the product is developed, that you need to get it out. It has to be a careful, thought out business plan if we are planning to look at entrepreneur. And loved ones need to be on board because it takes a lot of your time and resources. So your people, your family needs to understand what you are doing. And it has to be appropriate timing. You can't have something coming too early or too late. For example, he gives example of developing sutures for cataract surgery is like trying to do it for Martians. So in conclusion, being an innovator is extremely challenging, but it's extremely gratifying to take one's concept from your head into a clinical application and in using it in OR. These are my references, and thank you for your kind attention.
Thank you, Maneesh.